Hi everyone, I hope you're hanging in there. I think you're going to start seeing my hair grow in volume as we go through these videos the longer I don't get a haircut. But anyways, today we're here to talk about the silicone massage cups. If you've never seen these before, this isn't the video for you. This isn't trying to plug getting them, but I do know clients that I have that have these at home, and I just want to make sure that you're using them safely. They do have benefit if you're dealing with some pretty sore or tender, in particular shoulder muscles. You can't use cups on any skin surface. So one thing to be aware of is not to use cups on any broken skin or wounds, moles, any skin conditions like eczema, psoriasis, or hives, nothing like that you'd want to put a cup on top of. So keep that in mind. As well, any sensitive veins, spider veins, that sort of thing, especially in the legs. If you see that, you wouldn't want to put these on top of it. The other thing to remember is it's not supposed to be painful. So if you put a cup on the skin, and it's really painful right away, the suction is too strong. So you can change the suction of a cup just by pulling up one edge of it. It'll release some of the pressure and you can find a level that is pain-free. We want to stick with that. Also, another thing to be aware with cups is they will often leave a mark. And what that mark is not a bruise. It looks like a bruise. But what it is it's drawing up stagnant blood that's deeper in the tissues to come into circulation. Because the main reason for using cups is that it helps to pull apart the fascia layers of the tissue that tend to get really knotted and stuck together because of increased tension. So the cup helps to pull and bring space so that circulation can improve, nutrients can get to the muscles, and you start to have relief from pain that you're experiencing. Keeping that in mind, one reason you would not want to use cups is if you are dealing with any respiratory symptoms, any cold or flu symptoms, or if you're just getting over a cold or flu. Because what these will often do is they'll draw any remaining congestion up to the surface. And it's not like you'll get sick again, but you will start to go through some of those symptoms again so that the body is able to flush it out. So it will help you get better faster, but you'll be suffering in the meantime. So just stay away from cups if you're dealing with any of that. I also recommend not using cups when you're pregnant because one, how it increases the circulation of these congested pieces. We don't need any additional toxins moving in your bloodstream, potentially reducing your immune system at this time. So other than that, what I would recommend is sticking to your upper shoulders and mid-back, and you can use the larger cups on your glutes and maybe into your IT band. Other than that, I would kind of stay away from it. Unless your calves are really you have no vein issues, you could probably use them into the calves too if you're dealing with any tenderness there. I'm just going to show very quickly how to use it on the shoulder. The main thing is you want to push down and then you're pulling up on the edge so that you're creating that suction. So it's harder to do on yourself, but I just pretty much lift up one side and pull down like that. Now, you don't want to leave these on for more than 2 to 5 minutes at a time. So don't put them on and start watching TV and totally forget about them. Set a timer so that you're staying really conscious of it. The bruising is not actually bruising. It just looks like it. But you can break the blood vessels, and those look like little black spots. So you want to be able to watch the color of the skin. So it's great if you can do it with somebody else around so that they can monitor the skin color. If it starts purpling, that's your sign to actually remove it altogether. You don't need to do it any longer. So once the cup is on, you can just leave it like this, or you can pull up a little bit. That helps to pull apart those fibers. You can do little circles. Ooh, that didn't work really well. Both directions, and you can kind of stretch it and pull it side to side. And then to remove it, either it'll pop off on its own or you just lift up one edge, which is also the way you would just remove a bit of that pressure if there's pain, and then you just remove it. Now, if you can kind of push the blood into circulation. You just want to move it towards your heart or towards your lymphatic system. So that's up in here in your armpits, in the lower part of the body into the groin. That will help to flush any additional stagnated blood, and it will help to reduce that marking as well. In the glutes, you're pretty safe to do it anywhere. With the IT bands, I find it helps to just start at somewhere at the top of the IT band. If you know what the IT band is, then you can use this. It's pretty much the side of your leg. I find it works better than any rolling. You just put one kind of in the top, mid, and towards the knee. And you could do some stretches or just let them sit on there. They can be a lot more painful. So again, watch your pressure. Next time, we're going to talk about nutrients. So nutrients, minerals, foods, fluids that you can take, supplements that help to increase the relaxation of your muscles and nervous system, and hopefully will help get you through this time of isolation until I can see you again.